Hello, today I'm going to be talking about health literacy and COPD. From the feedback that I got, I need to add more graphs and interpretation to make my presentation more interesting. I need also to mention some professionals available to help national and international agencies, governments. So I have added some graphs to my presentation to make it more interesting for the reader. So here, as the graph illustrates, the costs associated with COPD are substantial and encompass a range of expenses, including hospitalization, medication, and lost productivity. With the prevalence of COPD on the rise, it is important to address the economic impact of these diseases and invest in measures to reduce its burden. So we see here in 2010 the cost was like 32.1 billion, and in 2020 the cost was 49 billion. So as we can see, that's big difference, a big jump in numbers between the years 2010 and 2020. There are many professionals available to help individuals dealing with various challenges, including those related to health and well-being. In addition to doctors, nurses, therapists, there are also social workers, counselors, and other trained professionals who specialize in providing support and assistance to those in need, especially some people who doesn't have like insurance. Social workers are really good like in helping and finding resources for those kind of patients. In addition to these healthcare professionals, there are also national and international agencies, government, that are focused on addressing the challenges associated with COPD. For instance, the National Heart, Lung, and Blood Institute in the United States provides funding for research into COPD prevention and treatment, while the Global Initiative for Chronic Obstructive Lung Disease works to raise awareness about COPD on a global scale. Other agencies and organizations such as the COPD Foundation and the American Lung Association, which is a well-known agency, offer a range of programs and resources to help individuals with COPD and their families navigate the challenges of living with this chronic condition. By leveraging the expertise and resources of these professionals and organizations, individuals with COPD can receive the support they need to manage their condition and maintain a higher quality of life. So, as we know, COPD is a chronic inflammatory lung disease characterized by the obstructions of airflow in the lungs, which worsens over time. It is a term used to describe a group of lung diseases, including emphysema, chronic bronchitis, and refractory asthma. The most common cause of COPD is smoking. Cigarette smoking is the most common cause of COPD, accounting for up to 90% of cases. Other risk factors include exposure to air pollution, secondhand smoke, and occupational exposure to chemicals and dust. Genetic also play a role in the development of COPD, and a rare genetic condition called alpha-1 antitrypsin deficiency can increase the risk of developing the disease. From my personal experience, I've seen a lot of patients. The most common cause is smoking. But for the alpha 1 antitrypsin deficiency, it's very rare. I would say I've never seen it on a real patient. But yeah, my colleagues like have seen it, but it was just like um, one patient in like 1,000 or more patients. But definitely by avoiding smoking, we can avoid a lot of diseases, not only COPD. Treatment for COPD. To be real, there is no cure treatment for COPD, but it's mostly prevention. But treatment can help just manage symptoms and slow the progression of the disease. The mainstay of treatment is smoking cessation, which is crucial in preventing further lung damage. Other treatments include bronchodilator, which help open up the airway, and inhaled corticosteroids. It's like more patients like usually who have like frequent exacerbations, and those mostly like the type of patient we're receiving in the ER and that we deal with. So all these patients who are using the bronchodilators and corticosteroids, which help just reduce like the inflammation in the lung. Pulmonary pulmonary rehabilitation programs, which involve exercise, training, and education, can also improve symptoms and quality of life. So always, if the patient changes their lifestyle, there will be an improvement. It's, as I said before, there is no really a cure for it, but we can prevent like a further damage just by using these medications, the inhalers, and also changing the lifestyle, healthy food, exercising, trying to be active. So, health advocacy for in Congress. Here are some statistics that highlight the need for health advocacy of COPD. According to the World Health Organization, COPD is the third leading cause of death worldwide, with 3 million deaths in 2019. That's a huge number. In the United States, COPD is the fourth leading cause of death, which is more than 150,000 deaths per year. Again, that's a very big number, like in the US. And it's mostly caused by something that is very preventable. It's smoking. The economy burden of COPD is significant, with estimated cost of 50 billions per year in the United States alone. COPD is often underdiagnosed and undertreated, with many patients not receiving the appropriate care needed. Health literacy in Chicago's community. Determining the health literacy level of a specific community can be challenging and requires extensive research. However, there are some general trends and statistics that may provide insight into the health literacy level of Chicago's community for COPD. A study published in the Journal of Asthma and Allergy found that among a sample of low income patients with COPD in Chicago, only 43% had adequate health literacy. The study also found that those with inadequate health literacy had lower knowledge of COPD, were less likely to receive recommended COPD treatment, and had a higher rate of hospitalization for COPD exacerbations. Unfortunately, that's what we deal in our everyday practice. We get a lot of those kind of patients, and most of the time it's the same patients. They come there in the ER, and then they're getting the treatment, stabilize them in the ICU, and then going back again especially those who are not compliant with their medication. So I feel like it's the we are running in the same circle. So definitely, people need more education about this disease so we can prevent and avoid these frequent exacerbations and admissions to the ICUs. So, according to the Chicago Department of Public Health, the prevalence of COPD in Chicago is higher than the national average. The department has launched several initiatives to improve the prevention, diagnosis, and management of COPD in the city, including increasing public awareness and providing education to healthcare providers, which is the most important part. So, the media, possible media for addressing the health of COPD's patients. I feel nowadays the communication is mostly done through social media. So everybody, I would say most of people are using social media to get their information from. So why not using it to educate those kind of patients? Not only that, educate their families, educate their kids, their parents, their spouses, because again that will help them like to prevent and avoid all these frequent exacerbations and help them to understand the disease, the process of the disease, and what changes they can do to help them develop really adequate lifestyle. So there are several media channels that can be used to address the health of COPD patients. Here are some examples. As we say, social media such as Facebook, Twitter, Instagram can be used to provide education and raise awareness about COPD. Health organizations, hospitals, and medical professionals can share information, tips, and resources about COPD, management, treatment, and prevention. Online forums and support groups. Online forums and support groups can provide a platform for COPD patients and their families to connect with others who have similar experiences. Print materials, brochures, flyers, and posters can be distributed in hospitals, clinicals, community centers to provide information about this disease. Mobile apps. So, mobile apps can provide patients with tools to manage their COPD symptoms and track their medication use. It is important to tailor the media approach to the specific needs of these kind of patients, taking into account factors such as age, socioeconomic status, and level of health literacy. As a conclusion, COPD is a chronic respiratory disease that affects millions of people, not only in the US but also worldwide. Education and health literacy are essential in prevention, management, and treatment of COPD. By promoting awareness and understanding of the disease, we can help improve the life of those affected by COPD and work toward reducing the global burden of this chronic respiratory disease. Media channels can be used in combination to provide a comprehensive approach to COPD education and support. Thank you.